We're also in the heart of cold and flu season, which, according to the CDC, peaks between December and February. To find out what other viruses, bacteria, and infections are causing problems, I checked in with doctors across the area to find out what's bugging Metro Detroit. At Beaumont Grosse Pointe, they're seeing COVID and lots of it. That's according to Dr. Asha Shahjahan, Medical Director of Community Health.
I would say the second thing would be upper respiratory symptoms of just a regular cold.
So the runny, stuffy nose, sore throats, cough, sneezing, and congestion. And these are people who are testing negative for both COVID and the flu. Third would be strep. Patients come in with a very sore throat and possibly a fever and lymph nodes swelling around the neck.
If you see small little areas of white patches in the back of the throat, that's more indicative of strep throat, and then usually the throat is very red as well.
At Premier Medicine Urgent Care in Livonia, they're also seeing a lot of COVID and doing a lot of COVID testing. In addition, they're also seeing a lot of non-COVID related sore throats, sinus issues, coughs, and body aches. And they say these issues seem to be lasting longer than normal.
I'm a primary care outpatient provider. So obviously, we're seeing COVID, but there's a lot of other things going on right now.
That's Dr. Jade Balaz with Ascension Providence Rochester Hospital. She says her practice is seeing a lot of hand, foot, and mouth, which is common in infants and toddlers, but can affect people of all ages. RSV is still circulating too.
Another big one that we're seeing is influenza. It's just the start of the season for influenza. So haven't seen a ton of it yet, but it's kind of just starting.
In addition to respiratory viruses, patients are coming in with bacterial infections like strep, sinus, and ear issues. And she says those are super common complaints.
And then pneumonia is a really big one too that we see, especially, you can get, a pneumonia infection after a viral illness like flu, COVID, a bronchitis, things like that.
The CDC recommends a 4-dose pneumonia vaccine for infants at ages 2, 4, 6, and 12 to 15 months. Pneumonia vaccines are also recommended for adults 65 and older, and children and adults with conditions that place them at greater risk can qualify too. Some of those conditions include sickle cell disease, chronic heart, liver, lung disease, kidney failure, diabetes, and those with cochlear implants. Now, your doctor can help you determine what's right for you. And of course, it can be really tough to tell if you have the cold, the flu, RSV, or COVID. Dr. Shahjahan says if you're suffering from a sore throat, cough, runny nose, headache, nausea, vomiting, GI issues, or even fatigue for more than 1 or 2 days, you should get tested for COVID-19. Now, the city of Detroit is opening up their drive-through clinic at Huntington Place, that's formerly TCF Center. Premier Medicine is also doing COVID testing 7 days a week from 10 a.m. to 3 p.m. And I was actually in that area last week, and I saw people lined up. They were in their cars. That line was forming around 9 o'clock. The demand for those COVID tests are real, but we can do a whole lot by just washing our hands. Every provider I talk to stress, just wash your hands more, and that'll do a lot to keep you safe.
It's so simple.